Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, Questions 1 to 12. You hear a consultant discussing health concerns with Mr. Turner. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Turner. I see that your GP has referred you to me for some ongoing health issues. I've gone through the referral notes, but it would help if you could tell me, in your own words, what you've been experiencing lately.
Good morning, Doctor. Yes, well, I've been feeling really off these past few months. It all started with these intense headaches that seem to come out of nowhere. And then, more recently, I've been feeling really tired all the time, even after a full night's sleep.
I see. Headaches and fatigue. Anything else that's been troubling you?
Yes, actually. My memory and focus aren't what they used to be either. I feel like I'm forgetting things all the time, and it's hard to concentrate on work. And there's this constant metallic taste in my mouth that just won't go away, no matter what I eat or drink.
That sounds frustrating. I understand it's impacting your daily life quite a bit. Have you noticed any changes in your mood or behavior, or maybe any irritability?
Oh, definitely. I've been much more on edge lately. Little things that never used to bother me just make me snap, and I don't even understand why. I've always been easygoing, but now I feel irritable all the time.
All right. And in terms of physical symptoms, besides the headaches and metallic taste, have you noticed any issues with your stomach, joints, or anything unusual with your coordination?
Now that you mention it, I've been having stomach pains off and on, and some of my muscles feel weaker than usual. Walking upstairs, which was never an issue, now leaves me a bit winded. My joints ache too, especially my knees and wrists.
It sounds like you're dealing with quite a few different symptoms. I see that your GP also mentioned some potential exposure risks. Do you happen to work around any metals, chemicals, or anything that might involve lead exposure?
Yes, actually. I work in a manufacturing plant where we handle a lot of metals, and some of the equipment is old. I'm not directly involved with the metal, but I'm around it most days. I've been there for almost 10 years now.
I understand. Long-term exposure, even at lower levels, can sometimes cause the symptoms you're describing. Lead, in particular, has a way of accumulating in the body over time, which could explain some of these issues.
I had no idea. Could that really be causing all of this?
Yes, lead poisoning can affect several systems in the body, particularly over extended exposure. It can lead to neurological symptoms like the memory issues and irritability you've mentioned, as well as physical symptoms such as fatigue, headaches, and even muscle and joint pain.
That's concerning, but it makes sense now that you've explained it. Is there a way to find out for sure if that's what's going on?
Absolutely. We'll run a few tests to measure the lead levels in your blood. If we detect elevated levels, it will confirm that lead exposure could be the underlying cause. We'll also check your liver and kidney functions to see how your body has been handling any potential buildup.
And if that is the case, what happens next? I mean, can it be treated?
Yes, it can. If we do confirm lead poisoning, there are treatment options, depending on the levels detected. Mild cases may only need lifestyle and diet changes to help your body eliminate lead, along with reducing any exposure. For more severe cases, there are medications that help remove lead from your system.
That's a relief to hear. So, what should I expect in terms of getting these tests done?
We'll start with a simple blood test to check for lead levels. If necessary, we'll follow up with more specialized tests. It may take a week or two to get all the results back and decide on the best course of action, but we'll ensure you're informed every step of the way.
Thank you, Doctor. I really hope this gets to the bottom of things. It's been exhausting trying to get through each day like this.
I completely understand, Mr. Turner. These symptoms can be quite overwhelming, but we'll work together to figure this out and hopefully get you feeling like yourself again.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Miss Ginny. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Ginny. It's nice to see you today. How can I assist you?
Good morning, doctor. Thank you for seeing me. I'm here because my migraines have been getting worse over the past few months. I used to get them now and then, but lately, they've been happening more often and seem a lot more intense.
I understand. Migraines can be quite challenging to manage, especially when they start interfering with daily life. Can you describe your symptoms during these episodes?
Sure. When I get a migraine, I feel a pounding pain, usually on one side of my head. It's bad enough that I feel nauseous, and sometimes I end up vomiting. I become so sensitive to light and sound that I need to lie down in a dark, quiet room.
That sounds quite severe. Have you noticed any particular triggers or patterns that seem to bring on these migraines?
I think stress is a big one. My job can be intense. I'm in marketing, so there's always a lot going on. I've also noticed that certain foods like chocolate and red wine can make things worse. And if I don't get enough sleep or go too long without eating, that can sometimes trigger a migraine too.
Those are common migraine triggers, and it sounds like you're already aware of a few potential lifestyle factors. How long do your migraines typically last?
They usually last about a day, sometimes a bit longer. There have been a few that stuck around for almost 3 days. When that happens, I struggle to keep up with work and take care of things at home.
I can imagine that would be incredibly disruptive. I see from your records that you haven't tried prescription medications specifically for migraines. Are you using anything over the counter for pain relief?
I've been taking ibuprofen, but it doesn't seem to work much anymore. It used to help, but now it barely takes the edge off. I haven't tried anything else yet.
Given the frequency and severity of your symptoms, we have a few options to consider. Migraines can sometimes be managed with lifestyle modifications and preventive strategies. But since they're interfering with your daily life, medication might be a good option to explore.
Could medication help prevent the migraines from happening? I'd be interested if it could reduce how often I get them.
Absolutely. There are preventive medications that can help reduce both the frequency and intensity of migraines. We also have acute medications, which are taken at the onset of symptoms to help manage the pain and related symptoms. Some options include triptans, which are commonly prescribed to relieve migraines, and certain preventive treatments like beta blockers, antidepressants, or anti-seizure medications.
That sounds hopeful. Are there side effects I should be aware of?
Some of these medications can have side effects, depending on the type. Triptans, for instance, are usually well tolerated, but can cause drowsiness or dizziness in some people. Preventive treatments vary, but we would start with a low dose and adjust based on how you respond. We'll monitor closely to make sure it's working for you.
I appreciate that. I'm willing to try a few options if it might help me get these under control.
That's a sensible approach. I also recommend keeping a migraine diary. It can help us track patterns, triggers, and how well the treatments are working. You could note your diet, sleep habits, stress levels, and anything unusual you notice.
That makes sense. I think it might even help me see patterns I hadn't realized before.
Great. In addition, we might consider a few lifestyle adjustments. Ensuring regular sleep, eating balanced meals, and staying hydrated can make a difference. Techniques like mindfulness or relaxation exercises can help manage stress, which may also reduce the frequency of migraines.
I've heard a little about mindfulness, but I've never tried it. I'm open to giving it a go if it might help.
Studies show that mindfulness, meditation, and even gentle exercises like yoga can be helpful. These practices reduce stress levels and might help prevent migraines over time. Let's set up a plan where we combine lifestyle adjustments, medication, and a tracking approach. We'll evaluate after a few months to see how well this is working for you.
That sounds like a solid plan. Thank you, Doctor. I feel better knowing there are steps we can take to manage this.
You're very welcome, Ginny. Migraines can be tough, but with the right approach, many patients see significant improvement. We'll work through this together and adjust as we go to find what's most effective for you.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor's discussion with a nurse. Now read the question.
Okay, we're using the FUS score for this patient today. Let's go through each category. Yesterday, he was rated low on eye response, no movement or tracking. How are his eyes responding now?
No response still, unfortunately.
All right, that's a 0 for eye response. Moving on, what about motor response? Has he shown any purposeful movements or response to pain?
No, he hasn't.
That's another 0, then. And his brainstem reflexes, are we getting any gag or cough reflex with suctioning?
No, there's no reflex.
No reflex, so that's 0 for brainstem reflexes too. And for respiration, is he showing any attempt to breathe independently?
No, he's fully dependent on the ventilator.
So, that's 0 for respiration as well. With this score, his outlook remains critical, with very minimal responsiveness.
Now look at question 26. You hear a doctor briefing a colleague at the end of her shift. Now read the question.
I covered the basics with him today, discussing options if his condition progresses. He seems open to more support, so I've arranged for palliative care to join us tomorrow for further discussion.
Got it.
I also explained that he can think about appointing a healthcare proxy to help with decisions in the future. I encouraged him to bring his family in tomorrow for that discussion. He's stable now, but it's best if you ensure he has the serious illness conversation materials in his folder tonight, so he can review them before we meet again.
Understood.
Now look at question 27. You hear an intern asking a senior doctor about the diagnosis of a patient. Now, read the question.
Dr. Harris, I have a question about the patient experiencing recurring dizziness. Shouldn't we be considering an inner ear disorder like vertigo as a possible diagnosis?
Yes, that's certainly a possibility, but there are other factors you should look closely at to help narrow down the cause. For instance, while dizziness can often be related to inner ear issues, it's important to consider if there could be other underlying conditions. such as cardiovascular issues or even neurological disorders. Have you noticed any symptoms that might suggest one of these other causes?
Oh, I see. Like irregular heartbeat or any signs of nerve damage. Thanks for reminding me to examine the broader picture when looking at dizziness.
Now look at question 28. You hear a patient discussing dietary strategies with a dietitian. Now read the question. Lisa, I wanted to ask if managing IBS symptoms is always this challenging. I mean, I've noticed that whenever I eat certain foods, I end up feeling really uncomfortable, even if I thought they were safe.
It can be difficult, especially because IBS triggers vary from person to person. Some people are more sensitive to specific foods or certain combinations, which can make it hard to avoid symptoms entirely.
How do you handle situations like this? I mean, how do you balance avoiding triggers while ensuring I'm still getting the nutrients I need?
You have to remember that managing your symptoms is your primary goal, but it's equally important to maintain a balanced diet. You're accountable for finding what works best for your body, which might involve keeping a food journal or trying out different meal plans. There might not be an ideal solution, but there are several approaches to consider, such as
Now look at question 29. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question.
One of our key priorities is supporting patients in making healthy lifestyle changes, and we recently introduced a program specifically aimed at helping patients who want to quit smoking. The initiative, called Breathe Free, provides each patient with a counseling session where they can discuss any challenges they're facing in trying to quit. We also give them a resource kit with information about nicotine replacement options, relaxation techniques, and contact details for support groups. Patients are encouraged to talk about their progress with their families during visiting hours or even over the phone, which helps keep them motivated. The counselors then check in regularly to provide encouragement and advice based on what each patient needs. We've been really pleased with the response. Patients used to say they struggled to quit because they didn't have enough support or information, and this initiative gives them a better chance to succeed. It's been so effective that we're planning to make it available hospital-wide.
Now look at question 30. You hear an emergency paramedic talking to an accident and emergency doctor about an elderly patient involved in a motorcycle accident. Now read the question.
He's 68 years old and lost control of his motorcycle while braking suddenly. His chest hit the handlebars quite hard when he fell.
Right, that sounds concerning. How's his overall condition?
When we arrived, he was alert with a GCS of 15 and he complained of severe pain in his chest. He has no signs of head injury, but the main concern is a suspected chest injury with possible rib fractures. We've immobilized his chest and given him oxygen to help with breathing.
Has his breathing improved since then?
He's breathing steadily, but is still in significant pain. We've administered 100 milligrams of fentanyl and a total of 5 milligrams of morphine to keep him stable for transport.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview about the role of speech and language therapists in neurological rehabilitation. You now have 90 seconds to read questions.
Today I'm speaking with Sarah Dalton, a certified speech and language therapist who works primarily in neurological rehabilitation. Welcome, Sarah.
Thank you for having me. I'm excited to share more about how speech and language therapy can support patients on their journey toward recovery. Many people may not realize the full scope of our profession and how crucial it can be, especially after significant neurological events.
Let's start with an overview of your role. How would you describe the work you do in neurological rehabilitation?
My role involves assessing and treating patients who've experienced neurological impairments, such as stroke, traumatic brain injury, or progressive diseases like Parkinson's. I work with patients on issues related to communication and swallowing, aiming to help them regain independence in these vital areas. In many cases, patients experience both physical and cognitive difficulties, and our work can significantly impact their quality of life. Traditionally, this role might have been less understood, but it's now widely recognized as integral to rehabilitation.
So, what has led to this shift in perception about the role of speech and language therapists?
A large part of it stems from research highlighting the role of communication in patient outcomes. Patients' ability to communicate can directly affect their recovery process and mental health. As a result, there's now a much stronger emphasis on having speech and language therapists as part of multidisciplinary care teams. In the NHS, this focus has grown over the years, recognizing that better outcomes aren't just physical. They include emotional and social aspects, which our profession addresses.
I see. Could you tell us more about the types of therapies you provide in your practice?
Absolutely. We offer therapies that address various needs. For instance, after a stroke, some patients may have aphasia, a condition affecting language processing. So we use structured language exercises to help them regain communication skills. Others may have dysphagia, which impacts swallowing, so we work on exercises and strategies to improve their ability to swallow safely. Each therapy plan is tailored to the individual, and it often involves family members so that patients can practice techniques in their everyday lives.
That sounds quite comprehensive. Is there a case that comes to mind where your role made a significant difference?
Yes, actually. A recent case involved a young patient who suffered a traumatic brain injury from an accident. He had both cognitive communication issues and dysphagia. By working closely with his family and the wider healthcare team, we designed a therapy plan to gradually improve his speech, comprehension, and swallowing. Over time, he regained enough communication ability to re-enter social settings and felt more like himself again. His story is a testament to how speech and language therapy can be transformative.
That's wonderful. It sounds like your role is expanding. Is this development being formally recognized?
Yes, the field has introduced frameworks to support our expanding role. For example, in the UK, speech and language therapists are encouraged to develop along 4 key pillars: advanced practice, research, leadership, and education. The first pillar, advanced practice, involves staying updated on therapy techniques and managing complex cases. Research and evidence-based practice are essential too, as we need solid evidence to guide our approaches.
It's interesting that leadership and education are included. How do those apply to speech and language therapists?
Well, as part of a multidisciplinary team, we're often required to advocate for patients and lead discussions about their care, hence the leadership pillar. Education is equally vital, both in terms of educating ourselves to keep our knowledge current and educating other team members about how communication affects recovery. We also teach patients and families about therapy techniques so they can continue the work outside the clinic.
It's great to hear that such a clear framework exists. Are there any challenges that limit the reach of speech and language therapy?
The main issue is a shortage of resources. While there's recognition of our value in neurological rehabilitation, funding remains inconsistent. Many patients who could benefit from frequent therapy sessions may only receive limited support due to budget constraints. If we could secure more stable funding, we could offer more comprehensive therapy, especially for complex cases that require intensive intervention.
Thank you, Sarah. It's been enlightening to learn about the scope of speech and language therapy in neurological rehabilitation.
Extract 2. Questions 37 to 42. You hear a detailed presentation on preventive health screenings for older adults. Now, read the questions. You now have 90 seconds to read questions.
Hello everyone, and thank you for joining this session on preventive health screenings for older adults. As healthcare professionals, we recognize that preventive care becomes increasingly essential as people age. In this presentation, I'll be highlighting the types of preventive screenings that are critical for older adults, the health conditions these screenings aim to detect early, and the lifestyle changes that can help improve health outcomes in this age group. To begin, let's discuss why preventive screenings are so crucial for older adults. Many conditions, such as cancer, cardiovascular disease, and diabetes, often progress silently in their early stages, meaning they can go unnoticed without regular screening. However, catching these diseases early gives healthcare providers more treatment options and a better chance of slowing or managing the progression. Let's start with cancer screenings. Cancer risk naturally increases with age, and certain cancers such as breast, colorectal, and prostate cancer are more common in older adults. Screening recommendations vary depending on factors such as family history, lifestyle, and previous medical history. For instance, mammograms are generally recommended for women every 2 years up to age 74, while men might be advised to have prostate-specific antigen PSA tests depending on their risk factors. Colorectal cancer screenings, which can include colonoscopies or stool tests, are also a high priority and can be done at intervals depending on previous test results. Now, let's look at cardiovascular screenings. Heart disease remains a leading cause of death among older adults, so regular blood pressure and cholesterol checks are critical. For example, high blood pressure often has no obvious symptoms, yet it significantly increases the risk of heart attack or stroke. Screenings for high blood pressure, cholesterol, and diabetes can help detect these risk factors early, enabling preventive interventions. For diabetes, a common method is the HbA1c test, which provides a long-term picture of blood sugar levels and can help in both diagnosing diabetes and managing it if already present. In addition to these screenings, immunizations also play a vital role in preventive care for older adults. As the immune system weakens with age, older adults become more susceptible to certain infections. For instance, annual flu shots are recommended, as are vaccinations against pneumonia and shingles, which can have serious complications in older adults. A yearly flu shot is generally advised, while the pneumococcal vaccine is often recommended once after age. The shingles vaccine is particularly important, as shingles can cause prolonged pain and other issues that can greatly impact quality of life. Now, beyond specific screenings, lifestyle changes are also integral to preventive health. For older adults, remaining physically active and maintaining a balanced diet can reduce risks of many health conditions, including heart disease, diabetes, and even certain cancers. It's also beneficial for mobility and balance, which reduces the likelihood of falls, a common issue in older adults. The recommendations include regular physical activities such as walking, light resistance exercises, and stretching. Nutritionally, older adults may need to focus on maintaining adequate levels of protein, fiber, and essential vitamins like D and B12. Our research involved interviews with primary care physicians to understand their views on preventive health screenings for older adults. The physicians highlighted barriers and emphasized the importance of regular follow-ups. A common barrier noted was the challenge in balancing these screenings with the limited appointment times that are often focused on immediate health concerns. Physicians also emphasized that many older patients were hesitant about certain screenings due to fear or lack of understanding, underscoring the importance of effective communication. Another challenge was the complexity of coordinating screenings for patients with multiple health issues. For example, a patient with both heart disease and diabetes might require more frequent and targeted screenings. As one physician shared, balancing preventive screenings with the management of chronic conditions is a challenging aspect of care in this age group. With the right planning and patient education, however, we can often identify conditions earlier and help patients make proactive choices. In summary, preventive health screenings are essential for older adults, but require a personalized approach to address individual risk factors and health conditions. Equally important are immunizations and lifestyle modifications, which play significant roles in maintaining health and reducing risk of complications. Addressing barriers such as appointment time constraints, patient reluctance, and complexity of care coordination are key to improving screening rates and health outcomes among older adults.
That is the end of Part C. You now have 2 minutes to check your answers.